Okay, so if we were discussing about the side effect of the benzodiazepine. Benzodiazepine cause drowsiness and lightheadedness, then the confusion and ataxia, especially in the elderly, amnesia and the muscle weakness also, then headache, vertigo, tremor, dysarthria, hypotension, decreased libido, okay, erectile dysfunction, gynecomastia, and urinary retention. Then it also causes the talkativeness, excitement, then irritability, aggression, antisocial behavior, and suicidal ideation. Okay. Then withdrawal symptoms, for example, anxiety, depression, anorexia, impaired concentration. Okay, withdrawal symptoms like anxiety, depression. Okay, then anorexia, impaired concentration, then insomnia, then abdominal cramps, palpitation, tremor, tinnitus, and uh, perceptual disturbances. Okay, withdrawal symptoms. Okay, these are the withdrawal symptoms like anxiety, depression, anorexia, then impaired concentration, insomnia, then abdominal cramps, palpitation, tremor, okay, insomnia, then abdominal cramps, okay, then palpitation, tremor, okay, then tinnitus and perceptual disturbances, okay. These are the side effect of the benzodiazepine. Okay, then tolerance and dependence. People who use benzodiazepine longer term can develop tolerance and eventually the dependence. Okay, who use it long for the longer duration may produce the tolerance and then the dependence. Okay, then we will discuss about the toxicity of the benzodiazepine. So features of benzodiazepine toxicity include drowsiness, ataxia, dysarthria, okay, then nystagmus, occasionally respiratory depression and the coma. Okay, so in when benzodiazepine can used in the toxic dose, it can cause the drowsiness, ataxia, dysarthria, difficulty in the talking, then nystagmus, okay, the pupil movement, abnormal involuntary pupillary movement, okay, and occasionally respiratory depression and the coma. Okay, this may also takes place. Okay, flumazenil is used to antagonize the effect of the benzodiazepine. Okay, when benzodiazepine taken as its toxic dose, fumezanil is used as antagonize the effect of the benzodiazepine. It can be used to reduce the sedative effect of the benzodiazepine. Okay, in anesthesia, intensive care, diagnostic procedure, and in overdose. Okay, it can be used in the to reduce the sedative effect of the benzodiazepine in anesthesia, intensive care, and the diagnostic procedures, and also in the overdose of the benzodiazepines. So which are the types of benzodiazepines? So midazolam has a short duration of action, less than 6 hours. Okay, midazolam has a short duration of action, less than 6 hours. Then lorazepam and temazepam. Okay, midazolam, lorazepam, temazepam, okay, have an intermediate duration of action. Okay, midazolam, lorazepam, temazepam have intermediate duration of action, 12 to 18 hours, and the diazepam and the chlordiazepoxide has a longer duration of action for 24 to 48 hours. Okay, so we have three different types of benzodiazepines uh, uh, by their duration of action. Okay, first midazolam has the short duration of action, less than 6 hours. Then the lorazepam and the temazepam, okay, we will remember only lorazepam have intermediate duration, 12 to 18 hours. duration of action, and the diazepam and the diazepoxide have the long duration 24 to 48 hours. Midazolam, lorazepam, and the diazepam or the diazepoxide. Okay, shorter acting compounds may be preferred in patients with hepatic impairment, but they carry a greater risk of withdrawal symptoms. Okay, shorter duration of action like midazolam can be used in the hepatic impairment patient, but it also can cause the withdrawal symptoms. Then chlordiazepoxide is routinely used for the symptoms associated with the acute alcohol withdrawal. Okay, chlordiazepoxide is used routinely for the symptoms associated with the acute alcohol withdrawal. Okay, then diazepam. Okay, it is used to produce mild sedation with amnesia. Okay, to produce the mild sedation with amnesia. Okay, it is a long acting drug with active metabolites, and period of drowsiness can occur several hours after its administration. Okay, diazepam is used to produce mild sedation. Okay, it is a long acting drug. Okay, with active metabolite, it is long active drug. Okay, uh, with active metabolites, and second period of drowsiness can be occur. Okay, second period of the drowsiness can occur several hours after its administration. Okay, after its administration, second period of drowsiness may also takes place here. Then temazepam, which is intermediate, is given by mouth for the pre-medication, and has a shorter duration of action and more rapid onset than oral lorazepam. Anxiolytic and sedative effect last about 90 minutes, although there may be residual drowsiness. Okay, uh, anxiolytic and the sedative effect is may be seen for about 90 minutes. Okay, then lorazepam. Okay, so lorazepam produces a more prolonged sedation than the temazepam, and it has marked amnesic effect. Okay, then midazolam. So midazolam is a water-soluble benzodiazepine that is often used in the preference to intravenous diazepam. In preference to the intravenous diazepam. Okay, recovery is faster than the diazepam. Recovery is faster, but maybe significantly longer in the elderly. Okay, maybe significantly longer in the elderly. In patients with low cardiac output, or after repeated dosing. Okay, long okay, in patient with the low cardiac output, and after repeated dosing, midazolam is associated with profound sedation when high doses are given intravenously. Okay, when it is used with certain other drugs. Okay, associated with profound sedation. Okay, so what we have seen in the types, that the midazolam has a shorter duration of action of around 6 hours than the lorazepam, and the temazepam has the intermediate effect of 12 to 24 hours, and the diazepam and the diazepoxide has the longer duration of action of around 24 to 48 hours. Okay, chlorodiazepoxide, okay, is routinely used for the symptoms associated with acute alcohol withdrawal. Then the diazepam, okay, is used to produce mild sedation with amnesia. Okay, then the tamzepam uh, is anxiolytic and sedative effect lasts about 90 minutes. Okay, and it may produce residual drowsiness. Then the lorazepam has a prolonged sedation than this temzepam, and has marked amnesic effect. Okay, and the midazolam is water soluble benzodiazepine, and it's used in preference to intravenous diazepam. Its recovery is faster, okay, and is used in the elderly because its use may be done in the low cardiac output and okay, in that patient.